friend of the show, Mr. Todd Hickey, Senior VP over at Vidant Medical Center. Good morning, Todd.
Good morning, Doug.
Happy St. Patrick's Day. Good to have you in here.
Happy St. Patrick's Day to you. Thanks for having me.
You've got a little splash of green there, so you'll
I do.
avoid those irritating pinches that are going around. We've got some exciting news coming up here at the end of the week for folks in Greenville, and it is going to be the groundbreaking of the physical groundbreaking on something that's been talked about for a long time and is going to affect a lot of folks, and that is the groundbreaking of the new cancer center for Vidant. So why don't you talk to the folks a little bit about what's coming up on Friday and why that's so important?
Well, Friday at 1 o'clock, we will be having our groundbreaking ceremony for our new facility for cancer care. And it's going to be just a wonderful event, along with supporting what's going to be a great resource for Eastern North Carolina. It is a 420,000 square feet facility with the entire first floor, 125,000 square feet, committed to outpatient cancer care. Within that facility, we will be providing increased access to care, capacity, easy access, no wait time kinds of model of care, and the full array of cancer services will be provided. Chemotherapy and radiation treatment, along with all the physician services and cancer care that we can offer. It will be really one of the best cancer centers in the country come March of 2018.
Right, you've got an expected date to open those doors in March. You're going to, I said, the groundbreaking this Friday, and really the trucks and everything are going to start rolling in mid-April.
That's correct.
Vidant already known in the area for their excellent cancer care. What is this facility going to provide? What's it for somebody who says, hey, I already know somebody who goes there and everything's fine? What is this facility going to add to the already excellent care that Vidant's providing in this area?
Well, it will provide the location for cancer care as a final place for patients to have to go for the highest level of care, along with general oncology services. So the highest acuity care, most complex level of cancer care we'll be able to provide in one facility. And all of our inpatient units, as well as all of our outpatient services that are located in Greenville and on the hospital campus, now will be housed in one specific location. That means easier access for our patients, our visitors, our physicians and nurses from all subspecialties of cancer care, practicing in one location. And that team-based approach to cancer care is what helps improve outcomes and coordination of care for our patients.
We're talking with Todd Hickey. He's the Senior VP of Vidant Medical Center. We're talking about the groundbreaking coming up Friday at 1 o'clock for the new cancer center there at Vidant, and that's going to be next to the East Carolina Heart Institute, right there on the Vidant Medical Center property. What is this new, when it opens up, what is this going to mean as far as volumes? I mean, do you have a situation now where maybe you're at capacity that this is actually going to allow more people to get their cancer treatment right here in Greenville?
It will, Doug. But the secret is not just in the facility. It's in the model of care that Vidant Health is committed to. So, as you know, Vidant Health has been a provider of health care in Eastern North Carolina for years, and we have made those commitments throughout many towns in Eastern North Carolina. We have cancer programs as well that support each one of our hospitals that we have in Eastern North Carolina and create a community-based presence for cancer care. Our goal is for care to be provided as close to home as possible. But for when it can't be provided, and we do provide state-of-the-art, highly trained physicians and nurses to be able to provide that care, but when that care has to move to a higher level, for a level of service that's based on the highest acuity in each of our major disease teams, then we have a facility now that can house that and bring it together. And that brings connectivity, both not just in a location in Greenville, but a virtual connectivity so that each one of our locations can participate with the coordination and care being provided. And that increases the volumes and has a facility now that can handle that capacity.
Todd, it's an unfortunate fact of our lives. Cancer touches so many of us. I unfortunately lost a sister in Florida last year to cancer, and I can remember her telling the stories about the treatments, but it wasn't just the treatment, it was the travel. She had to go to a facility that was a little bit distant from her home. You mentioned about trying to stay close to home. Why is that so important that when you're going through this type of treatment that you have a facility where you can stay close to home?
It's important because we know that early detection is the key. So when we provide cancer care and it's detected in stage 1 and 2, then your chances for cure are greatly increased. When we can provide care close to home, your friends, your family, your primary care physician that was involved with detecting that cancer, all stay connected to your cancer care, and you can be more successful in following your treatment plan. So the appointments, the care model that you have to follow, it's taxing on everybody involved. You need a support system to do that. And we also help in that arena. We have a system of care navigation and social services, social workers, oncology certified nurses that are dedicated to these patients to ensure they're following a treatment plan. And this is where Vidant Health is unique. We provide this care at every one of our locations, and it's inclusive. We are committed to it. Every one of our places, from Outer Banks, Ahoskie, Tarboro, even our partnership in Onslow, in Jacksonville for cancer care, we are committed to Eastern North Carolina and have done so for many years and will continue. And this is another example of our commitment to the care in Eastern North Carolina.
Todd, as we finish up, we're talking about the care, and obviously that's most important. But let me ask you from a perspective, you're the senior VP there at Vidant. You don't just decide, let's build a cancer center and go out and, get the local construction company to show up. Talk about the vision, how this came about, and the years of planning that took even to get to this point to do the ceremonial groundbreaking on Friday.
It did. So as a health system, we have to prioritize resources, as any health system does. And as you can see, and the community can see, we committed to cardiology, pediatrics, and now cancer. And so these are the facilities that designate where we're going to make a difference. And honestly, 7,500 new cases of cancer care will happen in Eastern North Carolina alone this year. That's such a priority. And the mortality in cancer in Eastern North Carolina is higher than it is in any other location in the state. So the incidence of cancer and the high rate of mortality demands that we create a model that ensures success of these patients. And we need the success of all of our patients. We see patients that travel to the Triangle to receive care. That cannot happen in this model. We know that we provide the best care possible. It's our family caring for yours. And if somebody has to travel to get a better, to receive a different treatment, a clinical trial that we don't offer, we will coordinate that care for them. We are committed to that level. But otherwise, every patient that needs cancer care can get it in Eastern North Carolina. And we have a network, whether it's the physicians at the East Carolina School of Medicine, whether it's our partnerships with Physicians East and other prominent physician groups in Eastern North Carolina. It's an inclusive model, and we want all involved to be able to take care of these patients.
Todd, thanks so much for coming in this morning. I know a lot of folks in Greenville and the surrounding areas very excited about this. And once again, that groundbreaking is going to be this coming Friday at 1 o'clock right there next to the East Carolina Heart Institute on the Vidant Medical Center facility, the groundbreaking for the new cancer center. Todd Hickey, Senior VP at Vidant, thanks so much for coming in.
Great.
And look forward to hearing more. I know you're going to be on with Henry giving updates as this great project continues.
That's correct.
Thanks
Thank
so
you
much
for having me.
Yep.